But some people don't just care. They don't want to know, They don't just care. Even if you talk from January to December, it just give you their fears.
Emmanuel Cissé explains to a group of journalists the challenges they face as part of their work promoting vaccine confidence through community awareness raising.
We have a management committee. We call it the Community Management Committee. For every PSU, they have that committee. That committee is built up of stakeholders in the community. So before any intervention, you call the stakeholders, you discuss with them, you plan properly, and then you go out again. We normally use these megaphones. We have the CHWs, community health workers. They are our forefront workers.
Can you please tell me what is happening at the facility at the Convened Center Hospital? I say, William, please talk to me about the Ministry of Health.
What has been the means so far you engage community doula? Because according to you, out of 100 you engage, only one person can adhere to it.
This is the first ever media cafe in Sierra Leone, which provided a rare platform for journalists, health workers, and religious leaders who are involved in the Promoting COVID-19 Vaccine Equity through Faith-Based Networks in Africa project to discuss their mutual interest in an informal setting. Emmanuel is both a health worker and a religious leader. His health facility is part of the Christian Health Association of Sierra Leone, CHASO, a network of faith-based health institutions. Religious leaders have a huge influence on the Sierra Leonean society, and through this initiative, they have had a great impact in efforts to change wrong perceptions about vaccines and other public health issues. One challenge they continue to face, however, is cascading their messages to a larger audience beyond their congregations, hence the need for collaboration with the media. That is partly what this initiative, with the technical support of Internews, seeks to address.
It's about promoting vaccine confidence with specific focus on the COVID-19 vaccine. As you know, there is a lot of misconception, skepticism about the COVID-19 vaccine. And the goal is to, help people, sensitize people, to let them know that the importance of accepting the vaccine, and also to dispel all these rumors that surround the vaccine.
Kemo Cham, science journalist and editor of Manual Reporters, hosted the Media Cafe on behalf of the Internews Health Journalist Network.
In order to engage the public effectively, positively, to get the public to know that in the first place these vaccines are there and they are good, you have to get the journalists involved. And for the journalists to do that work, they need to be able to engage with the health workers, the people who implement this vaccine confidence project. And we brought in together these journalists and the health workers and the other members in the consortium. We bring them together so that they can discuss and iron out some differences between them.
20 journalists attended the event from December 21st to 22nd. The participants, who included a small number of student journalists, interacted with a total of 6 guests discussing vaccine safety, fears and misconceptions, as well as a thorny relationship between the media and health workers. News editor at Premier News newspaper, Stephen V. Lansana, never considered religious leaders as potential sources on any issue outside religious matters. William Wise, a reporter with the public broadcaster SLBC, had a burning concern about the reluctance of health workers to talk to journalists. The discussions at some point got tense as these journalists poured out their heart on issues hardly spoken about in public, but which they say adversely affect their trade.
Easy forget foreign doctors them overseas for talk to we Dania. We where they work on fellowship, and it really sad. Honestly, it really sad. Sometimes past the foreigners then they book appointments for we are. It's like una way we get no value we. because of this fear, say they are not professional, they are not well educated. Bring the education so we level them, we disseminate it to the public. That's it.
The guest also had concerns and misconceptions about the way the media operates. Imam Alhaji Momodu Koroma always thought that one would need a lot of money to express their views on a media platform. The journalist explained the difference between paid-for programs and public interest content that don't normally require payment to be aired or published. Mr. Koroma also learned how to engage the media to get his voice heard as an opinion leader, among others. Majority of the participants are members of the Health Reporters Network Sierra Leone and the Kombra Media Network, the two functioning professional bodies for journalists specialized in reporting health in the country. 5 were student journalists from the Mass Communication Department of Rabe College in the University of Sierra Leone. Unlike Imam Alhaji Koroma, Reverend Ali Saidu Conte isn't new to dealing with the media. In fact, his experience working on the COVFAB project as a vaccine champion helped improve his relationship with the media and understanding of how journalists work. Reverend Conte has implemented several media-friendly initiatives he says have given him a wider audience beyond his congregation.
We have a lot of important programs that need to come out into the media. Sometimes, for every church setting, you have the board, the board of administration. For them, the concern really is our money. You present it, but we want to call the journal, they will ask you the money. Yeah. So they too, they are scared. But wherein you opt yourself, and we know that when our story comes out, it will sell, and then it will benefit a lot of people who come to hear it and get to know what we are doing. I think our doors will be open. And our hands will be open, sincerely speaking. Yes. Like my brother said, don't present the aspect of the matter. When I come, we have to bargain first as to what will be paid. But I think we also have conscience that when you have rendered us a service, no, we can't allow you to go empty-handed, something like that.
Conte, who recently retired as superintendent of the Wesleyan Church of Freetown, even established a communication team within the church, which interfaces with the media. Many of the journalists found the intersection between health and religion strange, but to Reverend Conte, that is strange to only those unfamiliar with the scriptures.
Seated here, I have a health condition. I had a heart attack, and I was flown overseas, and a stent is in my heart to open the heart artery so that blood can run. And I am on medication for life. My doctor told me, you stop taking your medicine, you will die. You getting me? I have faith. I preach faith. I encourage my people to trust God and His healing powers. I trust it too.
The US-based non-profit IMA World Health is leading the COVFAB project implementation in collaboration with the African Christian Health Associations, thanks to Osprey Foundation grant. In Sierra Leone, Chasu is the focal point. Its program manager is Martha Kanu.
Not that I don't want you to report, but there are some certain things that can change. Maybe your presence can help us change, because I know there are certain facilities in terms of IPC, that's infection prevention and control, they are very poor. So let's say you visit a facility that has that type of thing. We cannot see them at every time. Even though we have a supportive supervision, wherein we go and monitor our member health facilities, and when we see that they have poor hygiene in like the labor room and other aspects of the medical things, when you go there, you meet those things, you call us, we can go there, right there, because sometimes we do on-the-spot check.
Chasu, as a network of 43 health facilities, account for 30% of all healthcare services provided across Sierra Leone, second to the Ministry of Health, according to the association. This forum set off a much-desired collaboration with the association intends to take forward to enhance the relations between journalists, religious leaders, and its partner institutions.
So I am very privileged to be part of this kind of discussion. I've never been at a platform like this, so having this one was an opportunity to see how we can also put out some of the things that even our members, are going through, some of the challenges they have, and then moving forward, how we can get health workers to talk to us, give us timely information. We know we are now living in a digital world. So if you don't have a timely information, somebody somewhere will misinform or disinform the general public. This is not what we want when it comes to health reporting.
This is a breaking barriers conversation, because a frank conversation between us, the journalists, and the health experts, and also the religious people. The myth behind journalism rolling out, especially reporting on health issues, that is what we discussed, so that we can have the confidence in reporting on health issues, and myth that they can provide us the information so far we need to report, because health issues are very crucial issues. If we don't have the right information, we misinform the public, and hence we misinform the public. That is a big damage to society.